Elon Musk's Doge now working with the Centers for Medicare and Medicaid Services in search of potential fraud. It comes as some people call on the Medicaid program to push Americans to get back into the workforce to improve their overall health. Let's bring in Fox News senior medical analyst Dr. Mark Siegel. So it's Senator John Kennedy of Louisiana who writes about this. In the National Review, he says in part, quote, numerous studies have shown that human beings are happier and healthier when they are employed. Long-term joblessness is associated with higher rates of cardiovascular disease, depression, and anxiety. One study even recommended employment as a, quote, critical mental health intervention. He says that there are 15 million able-bodied adults without children on Medicaid who could probably re-enter the workforce. This is kind of like the idea that we saw back in the Clinton administration of welfare to work.
Or bridge to jobs. And I completely agree with everything you just said. It's 15 million that have been identified. John, under the Trump 1 administration, 13 states received approval for just this kind of program, and another 9 were applying for it when the Biden administration came in and nixed it. So this is something that's been on the table for a while. I agree with the issue that it improves health. I also think, by the way, that it's tied in with something else you're going to ask me about, which is people that are using Medicaid in the wrong way. They might have a way to make money, but they don't tie it in with their health insurance. So essentially, Medicaid is part of a nanny state. You know, the vast majority of people in this country get their insurance by working for it, and they're proud of it, and they might even take a job a little less than they want in order to get the health insurance to provide for their family. With Medicaid, it's uncoupled, and the federal government pays 70% of Medicaid across the board. So even though it's a state-administered program to a large extent, it's mostly a federally funded program, and fraud and abuse and misuse of Medicaid is a federal crime.
Yeah, I want to come to that now because nearly 1 in 4 Americans are on Medicaid. The costs are approaching $1 trillion a year, which is unsustainable. And now Doge is planning on going through it with a fine-tooth comb. Here's a statement from CMS on the collaboration with Doge. It says in part, quote, CMS has 2 senior agency veterans, one focused on policy and one focused on operations, who are leading the collaboration with Doge, including ensuring appropriate access to CMS systems and technology. We're taking a thoughtful approach to see where there may be opportunities for more effective and efficient use of resources in line with meeting the goals of President Trump. Do you think that there might be some waste, fraud, or abuse in the system that Doge uncovers?
There's no question. I see that every single day. You can, in some places, order a wheelchair every single year under Medicaid or rent one. You know, there's a lot of services that aren't needed. There's no control over it. The same thing with drugs. I call it a sick care system. We're spending about $1.5 trillion on Medicaid plus Medicare. I call it a sick care system, by the way, because it'll pay if you're sick, but it may not pay prevention. It doesn't pay right now for Ozempic or Wegovy or weight loss drugs, even though obesity is our biggest healthcare problem in this country right now. So this needs to be looked at. How do we save healthcare dollars by keeping people from getting sick in the first place?
Well, I can already hear the other side screaming from the rooftops about this. So we'll see where it goes. Doc, always great to see you. Thank you.
Great, John. Great to see you.
All right. Sandra?
All right, Congress.